Welcome to the Pegasus Learning Platform. Pegasus is your home for clinical simulation and learning resources. This presentation may be used for content overview and clinical competency and will cover pheochromocytoma, a catecholamine-producing tumor. A pheochromocytoma is a catecholamine-producing tumor of the adrenal medulla. However, these tumors can occur elsewhere in the body, including the chest, abdomen, and the brain. A pheochromocytoma causes an inappropriate fight or flight response, even if the person is not threatened. To understand the effects of a pheochromocytoma, it's helpful to understand what the adrenal medulla does and how catecholamines affect the body. The adrenal glands, located one on each kidney, have two parts, the adrenal cortex and the adrenal medulla. The adrenal cortex is the outer portion of the adrenal gland and secretes glucocorticoids, the mineralocorticoid aldosterone, and androgens, which are sex hormones. The adrenal medulla is the inner portion of the adrenal gland and it secretes catecholamines, epinephrine, and norepinephrine. These catecholamines are crucial for proper functioning of the autonomic nervous system. The autonomic nervous system can be broken down into the sympathetic, or the adrenergic system, and the parasympathetic, also known as the cholinergic system. This presentation will focus on a condition that stimulates the sympathetic system, and the sympathetic system controls the body's fight or flight response. The body activates this response when a person is threatened, whether from an external threat, an internal threat, or a perceived threat. It activates this response by releasing catecholamines, epinephrine, and norepinephrine, and catecholamines are responsible for the reactions that occur in the sympathetic or adrenergic state. Catecholamines react with beta receptors located throughout the body and produce the responses of the sympathetic or adrenergic system. Adrenergic sounds like adrenaline. That's the response it will elicit. These responses occur as the body prepares for fight or flight when threatened. Some responses you'll see in the fight or flight response include dilated pupils, as the pupils dilate to take advantage of any available light, an expanded airway to bring in more oxygen, increased respirations, increased heart rate to move that oxygen, increased blood pressure, decreased activity of the urinary system, decreased activity of the GI system, decreased salivation, which is the first stage of digestion, and increased blood glucose levels because the body needs oxygen as well as glucose in the fight or flight state. Because the fight or flight response is caused by catecholamine production and their reaction with beta receptors, it makes sense that the symptoms of a pheochromocytoma, which is a catecholamine-producing tumor, include the fight or flight response. Symptoms you may see as the body's in sustained fight or flight include hypertension, palpitation, tremors, diaphoresis, heat intolerance, weight loss, and hyperglycemia, increased blood glucose to provide the body with energy to fight or run away. Understanding that the patient is producing excessive catecholamine resulting in a fight or flight response helps clarify nursing actions and considerations. Nursing considerations and interventions would include monitoring vital signs and watching for tachycardia and hypertension, monitoring for symptoms of hypertensive crisis, stroke, myocardial infarction, monitoring serum glucose levels, providing a cool, calm, quiet environment, providing a diet high in calories, vitamins, minerals to meet the needs of the client, and preparing to administer adrenergic blocking agents. Diagnostic tests for pheochromocytoma include a 24-hour urine collection for VMA, which is a product of catecholamine metabolism, for metanephrine and catecholamines, all of which are elevated in the presence of a pheochromocytoma. Simply put, excess VMA may indicate that excessive catecholamines are being produced and broken down after use. The analysis of VMA levels in the urine may be used to assess for the presence of a pheochromocytoma or to assess effectiveness of treatment. Quick facts include a pheochromocytoma is a catecholamine-producing tumor. An important nursing consideration is monitoring for hypertensive crisis. Catecholamines are normally secreted by the adrenal medulla. Catecholamines are responsible for the fight or flight response. Vanillylmandelic acid, VMA, is a product of catecholamine metabolism. A VMA test is usually obtained with a 24-hour urine. The adrenergic response is the sympathetic response. The adrenal glands are located on the kidneys. A client with a pheochromocytoma may require a high-calorie diet, and medication to treat symptoms may include beta-adrenergic blockers. Please note that this is a brief overview only. This presentation may be used for review and continuing education. The care and treatment of patients with pheochromocytomas involve more than this presentation covers. Thank you for your attention to this resource hosted on the Pegasus Learning Platform.